all, I'm Kelly Nagle. This week, I explore the complex world of healthcare with Suzie Crincoli, who is the Vice President of Clinical Quality for CareThrough. Suzie earned her RN and MSN, and she is now pursuing her PhD at Rutgers University. Suzie's research interests focus on health promotion, as well as factors influencing differential organizational support for nursing practice within acute care hospitals, shift work, acute fatigue, and the impact of missed care on nurse and patient outcomes. Suzie has over 14 years of clinical nursing experience in the emergency room and school nurse settings, and currently assists hospital partners across the country with creating efficacy models around nursing practice and nursing support. My conversation with Suzie delves into the importance of healthcare to the country's infrastructure and economy, the evolving nature of healthcare and the need for innovation, and the essential role nurses play as healthcare providers. Fair warning, you might find yourself wanting to hug a nurse after listening to this episode. Enjoy. Suzie, good morning. So excited to talk about all things healthcare and the complexities of the healthcare system.
Thank you. I'm really excited to be here with you as well. Thanks for inviting me.
Of course. This is a huge topic to unpack. We heard Jeremy's side of the conversation and his really astute perspective, particularly as a type 1 diabetic himself, and how he sees healthcare in the US and the healthcare system. So really excited to be talking to someone who has over 14 years of clinical nursing experience, both in the emergency room, in the school setting, and as well as the corporate setting. That diverse background that I think will give us a very interesting perspective on our conversation. I'd love to jump right in with the idea of access to care and health equity. They're really buzzwords. And what does that mean to you? What do we as non-clinical individuals need to understand about health equity and access to care?
Well, health equity and access to care go together, right? Health equity, by definition, means that everyone, regardless of socioeconomic status, geographical location, etc., insurance, right? Whether you are insured or not, you should have the ability to get the same health care than anyone else. And we struggle with that in the US. We really do. It's a significant issue. And access to care goes hand in hand with that. Access to care, by definition, means does our population, every single part of our population, especially specific demographic of our population, have the ability to get to doctor's appointments, schedule doctor's appointments in a timely fashion, pay for their healthcare visits without insurance? Do we have programs in place that ensure that we can give everyone the preventative basic care that they need so that we have a healthy society? And I think health outcomes wise, we don't do that well in our country. We have some of the highest rates of obesity. Lots of our communities smoke, especially underserved communities. They don't have access to fresh fruits and vegetables, and they don't have access to transportation to get them to and from really critical and important appointments. And Jeremy talked about diabetes, and he's a type 1 diabetic, right?
Yes.
So for a type 1 diabetic, understanding and having access to fresh fruits and vegetables is really critical. They're taught at a very young age to count their calories, and that equates into how much insulin their body needs. If they're not able to do that because they don't have access or their parents can't afford it, they're set up for a really tough adult life.
It's interesting because you think about healthcare and you don't necessarily think about your grocery store or access to fruits and vegetables, but they go hand in hand. Nutrition, or even a healthy environment free of mold or other environmental factors that could affect health outcomes or exacerbate existing health issues. That it's more than just going to your doctor and going to your hospital to receive care.
Well, so for me, I always start, and I think I mentioned this to you before, I always think of everything. If we're talking about healthcare in the US, then I think about, well, what is our economy like? And how does our economy work? And we really are a good example of a mixed economy. So we do have some aspect of socialization via Medicare, Social Security benefits, et cetera. And we also have a very strong market-based system where our industries are able to sort of choose and rely on the principle of supply and demand to be profitable and grow and create economic sustainability in our country. Now, that being said, there's room for us to improve. So from an economic perspective, we're already a mixed economy. So for those people who may say, we can never be a socialized country, I don't think that we'll ever be a socialized country because that's not the way our economy was built. That's not the way our founding fathers have set up our country. And it's very unlikely that we will lead there. So the fear that precedes that notion should be really eradicated in my mind. It's just a knowledge misnomer. So it's important for us to understand that that's not the way that our country was founded. And moving forward, we do have room to create some really good social policy that protects the entire country. And I'm just talking about healthcare here, right? I'm not getting into politics or anything else. For me, what's important to me is that we have a healthy country. And I often say this, if our country and all of its people have access to care and are able to be healthy, our economy will be healthy as well, because that means more people will work. More people can get to their appointments. Children can get better educations, things like that. So I would love to see how politicians at the local level, I'm not talking about the federal government, because federal government can pass whatever they want. It's always going to come down to your local leaders. And at the local level, I would love to see some infrastructure set up around supporting our neighborhoods. For example, I live in a pretty small town, but I grew up in the third largest city in New Jersey. So my experience growing up in this huge inner city with lots of different types of people and really access to whatever I needed, because everything's available in a city. And then I'm moving to this little tiny town where we only have 2 schools, and that's grade pre-K all the way to the high school, 2 schools. I notice a big difference in the ability of the community to really reach out and help. So in an inner city, it takes a lot. It takes a village really to set up the infrastructure necessary to reach all of the community. And they do a pretty good job of that. I grew up in Elizabeth. Elizabeth 3 years ago was able to move their health outcomes up by 2 or 3 points. And that's a significant improvement from where they were. And really it tells a lot about the infrastructure that the leaders there are putting in place. In my little tiny town, I would love to see more being done at the local level. I often, say that, let's look at our COVID vaccines. We have lots of elderly here. Lots of nurses and police officers and first responders live here in this town. Why not just set up an infrastructure at City Hall and say, okay, I want to bring in my healthcare leaders from the community. Let's talk about how we can reach everybody. Maybe we go to church on Sunday. We know lots of the community here goes to church. Maybe we visit the senior citizens home. Maybe we set it up in the school gym, things like that. It doesn't have to come from the federal government. It doesn't have to come from the president of the United States. Maybe we need their support, but we also need to be able to, as a community, really be supported by our local politicians. And I think people shouldn't be afraid to go talk to them. Pick up the phone. You are why they're in that place in the first place.
You talked about Care Through and the work that they're doing. Do you think that's sort of the magic bullet to have more companies like Care Through helping to facilitate that? Or are there also options within the structures that exist themselves?
One of the unique, one of the most unique things about Care Through and what we do is, what we do is proprietary to our company, but we also like to teach our partner organizations how to do these things too. So I think, is it the magic bullet? Maybe right now it's the magic bullet. right? And what I've learned in my time with Care Through is we have to be able to evolve with the changes that come. For example, COVID, right? Prior to COVID, we were all in-person support for nurses. And during the peak of COVID in New York City, they put a pop-up tent at Mount Sinai, right? And our company was asked to support providers, physicians, with a technology assistant or a technical scribe, if you will. And that was done in the form of Speak. So that was really sort of the birth of this technology-based support system for providers. And we saw how well it worked, even with all the PPE donned, even with the masks. Our scribes were able to capture the information necessary to put into the electronic health record that satisfied the requirements of the government for COVID information systems. And from that, we thought about, well, why aren't we doing this for our nurses too? Hospitals can't afford more PPE. So our in-person support became expensive, but not because they didn't want to pay for it, but because there was this precious PPE that needed to be shared amongst the nurses, and they were reusing masks. And if they had the additional resources of our folks, that means that's double the amount, right? So we started talking about Speak for Nurses. And what I'm trying to say is, whether you're a political leader, a healthcare leader, faculty, an everyday citizen, a mom like me, my kids are here screaming in the background, you have to be flexible and able to sort of go with the shift of everyday life. And I mean that in every aspect. And Care Through has been able to do that. We have a small team, but our core mission is to support and provide efficiency for nurses and doctors. And as long as we stay really true to that, we're able to adapt our models and support our teams. So I do think that's the magic bullet. I wish that nursing as an industry was more open to private industry coming in and supporting them, but it's not their fault that they're not. Again, we go back to the organization and how it's structured, and nurses are bundled into an inpatient visit where our care is not itemized the way a physician's care is. So the incentive for a hospital to pay for an efficiency model like ours is not as big as it is for provider support. And as nurses, again, we need to go to our policymakers and say, hey, when are we going to start looking at the care that nurses give? Why aren't we itemized too? We're with the patients the majority of the time they're in a hospital. It's our responsibility to make sure that they return home in the same way that they came to us. And we're not able to do that, number one, because we're not able to practice top of license because there are significant shortages in our staffing. Number two, the care that we provide is not paid for on an itemized basis. A physician comes to visit you, you're getting billed for that physician visit. I'm not saying that you should get billed for every nursing visit because that would be astronomical, and that doesn't make too much sense economically either. However, what a nurse does should be taken a little bit more seriously. And Centers for Medicare and Medicaid, if you ever listen to this podcast, think about what nurses are doing and think about all of what you've written about quality of care. There's this saying that I love: few tasks reach the patients without first passing through the hands of nurses. So just think about that. Your doctor may say, I want you to have an IV put in because we're going to hydrate you and make sure that you feel better in a couple of days, and you get home, you're going to need medication and all of this. Well, the doctor's not putting your IV in. The nurse is doing that. And that seems like a small menial task, but you know what? When a nurse sits at your bedside and makes you feel comfortable and really is kind to you and listens to you and is empathetic about why you're there, and you get through that procedure, and after 3 or 4 days, you're feeling better and you're able to go back to your family, that's huge. I think that we value nurses. I think COVID has made us really value nurses. Certainly 2020 was the year of the nurse. I think we continue to be the year of the nurse in 2021, but focusing on what nurses do and the value they bring to the overall healthcare system outside of the hospital setting too.
I'd like to thank Suzie for joining me today. And if you'd like to see what Suzie's up to, you can follow her on LinkedIn as Suzie Crincoli or on Instagram at Onalims. That's at ONALIMS. I'd also like to thank all those who made this podcast possible. Our wonderful production team, the George Milton Group, Winnie the Move for our theme song, and my Teen Think Tank Project co-founder, Matthew DeSantis. Most importantly, I'd like to thank you, the listener. Let us know you're listening. Subscribe, rate, and review this podcast. And follow the podcast at problem_pod. For more information on today's topic, or to find out more about social justice programming for exceptional teens, please follow the Teen Think Tank Project at teen_think tank. Until next week, I'm Kelly Nagle.